Perfect. Okay. Welcome, everyone, to a new episode of the Expect Miracles podcast. We have a very special guest today, Dr. Priya Mistry, the TMJ doc. She is a phenomenal TMJ specialist out of Vancouver, Washington. I am thrilled to have her on the podcast today. I believe this is the first TMJ specialist we've had on the podcast, so this is great. Dr. Priya, how are you today?
I'm well. Thank you for having me.
Thank you for hopping on. I think I was just scrolling through Instagram aimlessly, and your page popped up, and you have so much content and doing such great work with the specialty of TMJ, and thousands of people are suffering with that. So it's an honor to have you on the show today.
Thank you. Thank you. I'm happy to be here.
Dr. Priya, where are you from originally?
So I grew up in Washington State, up near Seattle, but currently I am in Vancouver, Washington. That's where my practice is, which is just a little bit north of Portland, Oregon.
Very nice. And how did you get into this field? Were you just a general dentist at first? Did you go right into the specialty? What happened there?
Yeah, so I graduated dental school in 2007, and I practiced for about 11 years until I met my mentor in 2018. And my TMJ mentor was sort of one of the big TMJ names in the area. He was in Portland, and his name is Dr. Arthur Parker. So I met him sort of on a whim. I walked into his wife's jewelry store, and her and I got to talking, and she told me what her husband was doing. And I was so amazed that his whole practice was TMJ only, like no general dentistry, nothing else. And I thought, well, he must be really good at what he does to have a practice like that. But in dental school, and I went to a really great dental school, but we just didn't learn too much about TMJ treatment. So at that point, I had noticed that maybe I had 3 to 5 patients every year that would come into my general dentistry practice with, now I realize they had a disc displacement without reduction, which basically means the jaw was locked closed. They could barely open. They were in a ton of pain. And I didn't really recognize the condition or what to do about it, more importantly. And so I would sort of do what I could and keep my fingers crossed and hope for the best.
Yeah,
So I
yeah.
thought, here's my opportunity when I met his wife to shadow someone who treats this probably regularly. So I began shadowing him at the end of 2018. And we just hit it off from day one. And I went home and I told my husband, I said, this is it. This is what I want to do. I'm hooked.
Very
And
cool.
so, yeah, I got lucky. And so he mentored me for a good 3 years. And then he retired in 2021. I bought the practice and moved it just about 10 miles north to Vancouver, Washington, because that's where my house is and my kids are.
Very nice. I did a very similar thing with upper cervical, bought an existing practice and, just kind of built it off from there.
Yeah.
So Doc, where do you believe I feel like there's a lot of different avenues TMJ can start from. Does it start in the jaw? Does it start in the neck? Is it muscular? Is it a misaligned jaw? How do you, if a patient comes in and says, I have TMJ, what's your next step there?
Well, the next step is, the first step is always an examination, right? I mean, that's for all of us. But I found one of the most important parts of the examination is actually the whole history. My mentor would always say the mystery is in the history, because
Yeah.
their whole story will sort of paint this picture. And you can sort of pick parts out, like, hey, you've had 4 whiplashes in a row. Your neck is probably super involved, and that's speeding up to affect your jaw. Or there's really no history of any injury to the head, neck, or jaw, or any spine injury. There's no history of that. But then you look in their mouth and there's a bite pattern that's very prevalent, a few bite patterns with TMJ disorders. And you see, okay, there's that bite pattern, plus you're clenching and grinding. So you're just enhancing that bite pattern every time your teeth come together. Eventually the muscles and joints are like, enough, we're done here.
Very
And
cool.
dysfunction starts. And so I think it's so important to listen to everybody's story. And a lot of the exam is that. But then, of course, we do a muscle palpation exam. We feel the joints. I do a postural exam. I check leg length. Like, you probably
Very
not
cool.
most dentists doing that.
Yeah.
If there's a lot of whiplash incidents and the leg length is off, I start suspecting an upper cervical involvement. And so I have upper cervical chiropractors nearby that I work regularly with. So I feel like TMJ, like the causes for it, the way that it presents, it can be all over the board, and that makes it very tricky.
Yes. Now, when people come into my office for TMJ, I'm crossing my fingers, hoping the majority of it is coming from the neck because that's what I do. And there are cases where the TMJ it's not budging. And then I like to send people out to a TMJ specialist like yourself. So if you have somebody coming from like an upper cervical practice where their neck it's aligned, it's okay, and the TMJ symptoms aren't budging, what are you thinking?
So I'm usually thinking it's the bite, because even if the neck is like perfect, you get it exactly where you want it, the teeth are still coming together, and that can make the muscles and the joints very mad. And
Hmm.
so what an orthotic does is it sort of takes that imbalanced bite that may be contributing, that it's likely contributing to the TMJ issue, just out of the equation. And it puts the muscles and the joints in a very optimal position. And that has worked really well with my upper cervical patients, I guess the ones that have seen the upper cervical chiropractors in the area.
Very cool. Now there is an orthotic, there's a night guard, there's a permanent. Sometimes I have patients come in with the permanent. There's something permanent in their mouth that they can't take out for a while.
Yeah.
What? How does that work?
Tricky, I know. So the terminology is all over the board, which first
Hmm.
off is tricky. So the way I talk about it is there's just two words. There's a night guard and there's an orthotic. Now the word splint, which many people use too, I've heard dentists use the word splint for a night guard and an orthotic. So that's confusing. So I just don't even use that word. So we're just going to throw that one in the garbage. Night guard and orthotic is what I use. So a night guard you can get from the drugstore, you can get it from your dentist. All it does is protect your teeth. It does
Hmm.
not treat your muscles and your joints. So it prevents your teeth from breaking from the forces of clenching and grinding. So night guards definitely have value, but they're not
Right.
going to help you if you have a TMJ issue.
Interesting.
So what a night guard does is we take impressions of your teeth, so molds of your teeth or scans, however we get a record of your teeth. And then we basically look at your bite and we just replicate that. So we give you, or we don't even replicate it, we just give you a flat plane to kind of grind against or clench against. So you're just gonna, the muscle memory is there. So you're just gonna always try to clench or grind into your usual bite pattern.
Hmm.
Some people will grind a little forward to get out of that bite pattern, but it's still not guiding your jaw where to go. So that's a night guard. Now, a TMJ orthotic is very different because it does treat the muscles and the joints. So at my office, the way I do this, and every TMJ dentist is different, so I can only speak
Hmm.
for myself, is I have technology and software that measures where your muscles are the most relaxed. It's a very specific position called the correct resting length. Every muscle in our body has a correct resting length. So the bicep is resting like this. I don't know if you can see my arm, right?
Hmm.
And it's contracted like this. So many people come to me where all these muscles are just constantly contracted. And because of that, it causes a lot of pain. It builds up lactic acid, toxins, and they're in pain. And so we have technology that finds where the muscles are in their most relaxed position. And then we build a daytime and a nighttime orthotic. That's what I do at my practice, to literally hold the jaw or guide the jaw to that optimal position. Now, with the orthotics, there's like three dimensions that are really important. There's the right and left, there's the forward and back, and then there's the up and down, the vertical. The most important one to get right is the right and left. Our
Yeah.
joints cannot tolerate much right and left movement. And so the software that I have, I really rely heavily on that to get that right. I can't eyeball that.
Hmm. How
I
does the software work?
So basically, we use TENS therapy,
Okay.
transcutaneous electrical nerve stimulation, and what it does, we use it for about 45 minutes to an hour. And the TENS that we use is a very specific FDA approved one for the small, or FDA cleared one for the small muscles of the head, neck, and jaw. And so when the TENS is going, and I also put a little appliance in the mouth that kind of discludes the teeth and has these sort of
Mm.
water pillows, and those, that kind of serves as a water bed for the muscles, so they
Very cool.
finally get a chance to get out of that like angry position that they're in. But the tens is really important too. So after about 45 minutes to an hour of the tens, the muscles are usually sitting in their relaxed position, their optimal position. So then we record that with a very sophisticated jaw tracking technology. So it's like a headgear,
Very cool.
records it all. Yeah. So I'm very dependent on that for the right and left position, even the forward and back, which is the next most important. So
And
once
that will tell you if the left side, one of the muscles on the left side is tighter than the right,
it can,
and vice versa.
yeah,
Very
it can
cool.
tell you how much they're firing too. Just when your teeth come together, it can measure how much your muscles are firing. So we have EMGs also we can use with that software. So then you can put the orthotic in and also measure how much the muscles are firing, and it should be way less. So it's really an objective measurement. It's not like me eyeballing it. And that's what I see
Yeah.
with a lot of TMJ people that call themselves TMJ dentists and make orthotics. They eyeball everything, and you just can't do that.
Yeah.
Everybody's, in my opinion, so
No, I
everybody's
agree. Yeah.
position is different. So I use that technology. I also use my knowledge of their condition. So if their condition is mostly muscular, I rely heavily on that technology. If the condition is mostly joint, like there's a disc displaced without reduction, the jaw is locked closed, I use the technology. Yes, I definitely do. But I also know that the disc is too far forward and in. So
Hmm.
we have to build the orthotic to help recapture that disc.
So the
So
orthotics can recapture discs like that.
they can help recapture
It can
disc.
help.
Yeah, yeah, they can help. They can't. I don't think they can do it on their own. I've seen that happen maybe twice, but usually you need more than that.
Very cool. And so, what's the healing process like for somebody that gets their orthotic? I'm sure you have people that put it in and it gets better very quickly. And then you have people that have been suffering for 20, 30, 40 years, and it's going to take some time. So, is it like braces where it's slowly starting to realign? How does
Yeah.
the orthotic work over time?
So what the orthotic? So with it, I have my patients wear it during the day and during the night, except for when they're during the day, except for when they're eating or drinking. So
Hmm.
their bite does reset. And we're trying to hold the muscles and the joints in a really specific position to allow things to heal. But I'm trying not to change the bite because many
Hmm.
adults don't want to go through braces again. So it's
Hmm.
sort of a tricky balance because there is a chance your bite can change. If you're holding the jaw in a different position all the time, your jaw can start to adapt to that position, right? And
Right.
then what? Your teeth aren't going to line up.
Very
So
interesting.
it's sort of a tricky balance. And some people come in saying, I want braces after all this. So they don't care if their bite changes. And those are actually kind of easier cases because you can just tell them your bite's going to change. This is how it's going to go, whatever. But most people don't want their bite to change. So the healing process, once I give them the orthotics, I usually see them every 1 to 2 weeks, depending on the severity of the TMJ condition. When they come back to my office, and it's usually after they've had a neck adjustment, an upper cervical adjustment, um, then I come in and I do my own sort of therapy. And I learned recently, I didn't really know what it was called, but it's called craniofacial therapy. So we loosen up the muscles in the head, neck, and jaw. So I do that manually. And I start at the base of the neck. I work my way forward. It's basically like a really nice massage for
Very
your
nice.
head, neck, and jaw. And if they've just had their cervicals adjusted, I'm very gentle around the neck. I don't do
Hmm.
much there, and I kind of come forward. We work on the masseters a lot, the temporalis. I go inside the mouth, I release muscles. And then for those that have like the severe jaw issues, like the disc displacement, I actually manipulate the jaw. And I do this
Cool.
in a subtle but effective way to help the disc get back in alignment. And sometimes during that manipulation, that's when they'll unlock. The disc will
Very
get back
cool.
in alignment.
And you do the manipulation with your hands or instrument? How does that work? Very
Hands.
cool.
With my hands. And then once everything is lined up, loosened up after the therapy, I check and adjust the orthotics because they can't change, but the patient can.
Hmm.
And so once things are lined up really well, loosened up, we adjust the orthotics to try to hold what we just did. It's a chair side adjustment. Then I see them again in 2 weeks, and then again and again. And as they get better, I slowly notice like the first thing to go away is ear pain. For whatever
Mm.
reason, that's the first thing to go away. Then headaches, then jaw pain. Then if the jaw has been locked closed where you can barely open, it'll slowly start to click and pop again. So that means it's not locked anymore, but the disc is still coming in and out of alignment. And then slowly they regain their range of motion. I mean, it's really cool to see, but it's not overnight usually.
Absolutely.
Most people are in treatment anywhere from like 4 to 8 months, give or take
Yeah.
months. Like there are cases where a lady was coming to me with chronic headaches. Like she would just wake up with the worst headaches. And she said it was affecting her marriage. It was affecting her work. And she's like, I just know it's coming from my jaw. And so I made her the nighttime orthotic. And I usually give people the nighttime one first and a week later, the daytime one. She didn't even want the daytime one. She was like, I feel so good. I love this. She was thrilled. And so she did end up getting the daytime one, but yeah, I mean, some people it's overnight and some people it's a longer process, depending on the severity of the issue.
Yeah. And for those listening, TMJ is not secluded to jaw pain, kind of like what you mentioned before. Jaw pain, facial pain, gum pain, migraines, headaches, eye pressure, brain fog, like ear pain, ear clicking, popping. There's so many different symptoms. And that is just amazing. The work you do, you can clear up a lot of that with a precise jaw exam, orthotic. That's amazing.
Yeah, I love it. Like I'm very passionate about it. I love it. It's so gratifying. I can help people go back to, being happier around their loved ones or being able to work as efficiently as they want to. And it's really, really great.
Now, is there any case where you recommend like braces that will help?
No.
Or do you ever recommend braces or no?
No, I never recommend braces. And the reason is because my mentor really drilled into me that when the muscles in the joints are really dysfunctional and angry, there's clicking, there's popping, the jaw is locked, the muscles are mad, and jaw pain, headaches, facial pain, pain behind the eyes, whatever it may be, the phase 1 TMJ treatment, and this is probably the one thing that most TMJ doctors agree on. Phase 1 is always stabilize the muscles and stabilize the joints. Phase 2 is then move the teeth with braces to that stabilized position. So the few cases I've seen where I have patients come see me and they say that, oh, this dentist told me that the Invisalign would fix my headaches and it just made them worse. It didn't help at all, or it just didn't help, whatever it may be. That's usually what I hear. Invisalign to me, it's so much about lining up the teeth and getting them in balance, which is great because that can be what caused the problem in the first place, but it's not treating the muscles.
Oh yeah.
Yeah.
I had Invisalign, and anytime I got a new tray, my muscles would be on fire because things are shifting.
Yeah, things are shifting.
Interesting.
Yeah. So and my mentor would always tell me also that like the way the teeth fit together, like cogs on a gear, and the two joints, it's like a tripod-like relationship between them. So if these joints are clicking and popping, or you have a very limited range of motion, there's something going on in the joints. Why would you start moving teeth? Now all three legs of the tripod are affected. So fix two legs of the tripod and then go on to the bite. So that's kind of one thing that we all agree on.
Yeah. How do you feel about, does it ever come from actual, like the teeth or the wisdom teeth? How do you feel about the actual wisdom teeth surgery? Is that affecting TMJ at all, or are people getting it done unnecessarily, or any thoughts on that?
It's a tricky one. I think that if the wisdom teeth are positioned in a way where they can damage the teeth in front of them, which I've definitely seen, you've got to get them out. You've just got to get them out. And the tricky part is that many times people have no TMJ issues before the extractions, and then suddenly their like jaw locks closed, or they have a lot of headaches afterwards, or neck pain, or whatever. I've seen that a lot. And that's because the muscles have likely been compensating either because of neck injuries, spine injuries, the way the teeth come together, chronic clenching, grinding, and then suddenly staying open for that long and that wide is like the straw that broke the camel's back.
Yeah.
But if the patient never had pain before that, how is the oral surgeon that removed the wisdom teeth supposed to know?
Yeah.
So it's tricky.
Yeah.
I have a one size fits all answer for that one,
And you said phase 1, most TMJ doctors kind of agree on. When does the kind of fork in the road diverge there?
I think I recently came across one TMJ doctor who doesn't believe in any soft tissue work. Shouldn't touch the muscles. You need to leave them alone. The orthotics will do everything. And I just don't agree with that.
Yeah.
At all. I know another TMJ dentist that believes that once you give someone the orthotics, you never touch them again. They don't need adjustment. This is the perfect spot. That's that. I don't agree with that. So, I mean, these people have probably had successes doing it their way. So I'm not by any means bashing anyone, but there's so many different ways. And then there's people that will just make a night guard and call it an orthotic, or they'll make, I don't like that. And I
Yeah.
also don't like when many people will make a nighttime appliance and call it an orthotic, but it's just a sleep apnea appliance. Not
Hmm.
just a, those are important too, but it's a sleep apnea appliance. It's not a TMJ orthotic. So like there's so much, and there's no like standardized way of doing things, which is very frustrating for patients, you know? So that's why I created my channel, as a way to put more information out there. My YouTube, my, you know, everything, so all the socials.
Is there something, because obviously, your office is in Washington. I would like a lot of people to come see you, but is there anything that you can kind of lay a foundation for people listening and saying, listen, I have a lot of these issues. How do I find how do I know I'm going to a good TMJ specialist near me?
I,
You- How
yeah.
many people use that muscle equipment? Is it not a lot, or is
Well, that's
that?
the tricky part too. So that is a method of dentistry called neuromuscular dentistry.
Hmm.
And even among neuromuscular dentists, there's disagreement. So
Yeah.
even if you type in neuromuscular dentist in my area code, right? um, it doesn't necessarily mean that they've had a lot of success with treating complex TMJ cases.
Hmm.
And so I don't really have a great answer for you. I mean,
Yeah.
there's one guy who I would refer to. He's in Kansas City, Missouri, and there's and really like that's it. Like I don't have a lot of referrals. I have a really good TMJ physical therapist that I recommend in Miami Beach, Florida, but
Hmm.
these are like so far from me even. And so I've had people fly in from New Jersey, from Boston. I had a guy, he moved here from Toronto for 5 months, and he was like,
Hmm.
get me better and I'll go home. I was like, okay.
Very nice.
Yeah, we did it. I don't encourage people to come fly and see me because it's so expensive and it's
Yeah.
so disruptive to your daily life. But
Yeah.
I don't have a good answer. I am thinking of I am going to come up with courses
Yeah.
um, over the next couple of years, but I'm just not there yet.
How does it work when people come and fly and see you on the follow-ups for the follow-ups?
Yeah, I tell them they have to come every 2 to 3 weeks until
Two or
I say
three
it's
weeks.
longer. Yeah.
Yeah.
And if their jaw is locked, weekly, if possible. So I
Yeah.
don't try to sugarcoat it. Like I
Yeah.
don't say, here's the orthotic and buy, you're going to be better. That's just not how it works.
Very, yeah. Yeah, it sounds like you closely monitor your patients every 2 to 3 weeks, because
Do.
like you said that you don't want the orthotic to shift, or you don't want the jaw to shift and kind of nullify what the orthotic's doing.
Yeah, and it will eventually. I mean, that orthotic is going to need adjustment. So I've had a few people that just get the orthotic and like take off. And I'm
Yeah.
like, where are you? And so then they come back and they're like, well, this isn't helping. I'm like, it isn't helping because you didn't come back.
Right.
Then we get them back on track. And then they're like, oh, okay. And then they see the value of those extra appointments. They're super important. And so yeah, I think, and eventually we do get to a point where it's stable. Like
Yeah.
I don't have to adjust the orthotic anymore, and there's no more symptoms. So then
Yeah.
I release them from active treatment. I say keep wearing the nighttime one. I taper all my patients off the daytime one. But
Hmm.
I say keep wearing the nighttime one. Let me know if you need me. And
Yeah.
they usually come back if it breaks or if their dog gets to it, and we go from there. But I mean, at every single appointment with these follow-ups where I do the therapy, if your number one concern was ear pain in my right ear, number two was headaches, number three was facial pain, I don't know, I will ask, I will say, how's your ear pain? And they're like, oh yeah, I haven't had any.
Yeah.
Or how's your headaches? Oh, and it went from 3 days a week to like twice a month.
Hmm.
Or like, and I
Yeah.
always ask every single time so that we can really monitor what's changing and what's not. Right. And
Yeah.
so, yeah, I try to be as thorough as I can, but I do need people to come back.
Now the stabilization phase for upper cervical, depending on the case, I usually say, give it at least 3 to 6 months, just to get it stabilized. We're going to have to do more work after that, but that's usually a good ballpark figure just to get things stable again. I'd imagine it'd be similar with the TMJ work. How long do you tell people, because a lot of people want the quick fix,
I
and
know.
you got to say, listen, true healing takes time. What's a good ballpark frame with they have the orthotic in and they're getting it maintained properly, healing
Probably 4 to
process?
8 months.
4 to 8.
Yeah,
Yeah.
usually. Now, the severe cases where, like, say, the jaw has been locked for like 10 years.
Yeah.
I have no idea how long that's going to take. So
Yeah.
I saw one young lady, she came to see me 2 years after her jaw locked closed because she just
Oh
couldn't
my
find
gosh.
anybody. Yeah, it
Yeah.
took us 11 months to get her
Yeah.
unlocked, stable, out of pain. So, that's not in my 4 to 8 month range. So,
Yeah. And I'm sure this sounds like identical to upper cervical work. I'm sure people are still in pain and you have to be like, well, your orthotics in alignment. There's not much we are going to do today. We just got to let the healing continue to work, right? Because just because somebody's in pain doesn't necessarily mean that we need to shift the whole game plan around, right?
right. And with those people, we really focus then on like the soft tissue work that we can.
Yeah.
And that usually makes them feel much better for at least a few days.
Yes.
And
Yeah.
then many people I find too, I really grill them on this is, are you clenching really hard into your daytime orthotic? Because that's holding us back. Like you've
Yeah.
got to stop your daytime clenching and you can train yourself to stop. It's not easy, but you can do it. Nighttime, we can't help it. But daytime, if you're clenching all day into that orthotic super hard, you're delaying your own progress.
How do you tell your patients any tips and tricks to consciously stop clenching during the day?
It's kind of an annoying method, but
Yeah.
I call it the timer method. So for the first week, you put a timer on your watch, your phone, whatever you have with you all the time. That goes off every 20 minutes while you're awake. If you catch yourself clenching, you take a deep breath, you tell yourself to stop. I had a patient that snapped her wrist with a rubber band. I'm
Mm,
not saying I promote that, but it was a
just
little
like a little reset.
negative reinforcement that helps.
Yeah.
So the second week, you set the timer for every 30 minutes, the third week, every 40, etc. By the time you get to an hour, you're usually not clenching anymore because you've become so aware of it. 20 minutes goes like this. And people are like, oh my gosh, I'm doing this all day long. I didn't even realize.
Yeah.
And that's huge. So just the realization of like, this is what I'm doing is a big one.
That's cool. And yeah, I didn't think about that. So it's not even like they need an actual treatment. It's just, just to retrain their brain not to clench.
Mm-hmm.
Very nice. Now, is there anything else that you do besides the orthotics and night guards in your practice for the TMJ?
Yeah, well, the therapy is a
The soft tissue therapy.
yeah, the soft tissue therapy and the jaw manipulation are a really big part of it. And then making appropriate referrals when necessary. Excuse me, TMJ issues and airway, sleep apnea are very
Oh, yeah.
so. If we always have all our patients fill out a sleep apnea questionnaire, and if they've checked off a lot of yeses, like they wake up gasping for air, or wake up several times at night to use the bathroom, or wake up feeling exhausted, whatever it may be, we kind of talk about a referral to a sleep doctor
Mm-hmm.
to see if sleep apnea is an underlying issue. Because if we're struggling for oxygen at night, our body goes into fight or flight mode. We tend to clench and grind with more force, more frequency, and for longer durations. And that'll lead us to TMJ issues. And grinding the jaw forward actually opens the airway. So it's thought to be like a protective reflex almost if you are struggling for air. So, so many of my patients have sleep disordered breathing. I mean, it's probably well over 90%.
Yeah.
Mm-hmm.
And I'm sure you see that get better too with the orthotic.
It's really
And
cool.
yeah,
Really
because that's
cool. So like
that's
I'm sleeping
that's
better.
changing the jaw, which enables the
Yeah,
airway to get more
yeah,
air at night.
yeah. And to be fair, a TMJ orthotic is not approved to treat sleep apnea. So I
Right.
would say like if you can't tolerate the CPAP, if they're diagnosed with mild, moderate, severe sleep apnea, they usually get a CPAP and they can use that while they use my orthotic. Then once the muscles and joints are stable, everything's happy, no more headaches, pain, clicking, popping, whatever it may be. Um, then I say I can make you a sleep apnea appliance to treat your sleep apnea with your TMJ prescription built into it. So that's a pretty cool appliance.
Yeah.
It helps the muscles, the joints, and it opens the airway.
Very cool.
So I've only done that for maybe a handful of patients because many people can actually tolerate the CPAP. So then we don't need to go there.
Yeah. And how did you come across upper cervical? Because you said you work with a couple doctors, and I think the upper cervical and the TMJ specialty goes hand in hand too.
My mentor, worked with a few in the area, and so I just didn't stop once I took over. My mentor is a very unique man. So
Hmm.
he is a dentist like me,
Hmm.
but he took a lot of TMJ physical therapy courses from the renowned TMJ physical therapist, Mariano Roccabato. So he took those courses. He worked with a very famous osteopath. He learned craniosacral therapy. I'm trained in craniosacral work. Like he just dabbled in everything. And then he took everything he learned and he came up with what we're doing.
Made it his own. Very cool. Always be learning, right?
Always be learning. And yeah, always be open-minded too.
Absolutely. Right? And it definitely can take a team of practitioners to get, one person better these days. There's chemical toxins, there's physical stressors, there's, our work life, everybody sitting down all day. It can take a team of people to get someone better. And sometimes it doesn't work the first time around and you revisit it 6 months to a year later and it starts working. So
yeah,
never lose hope. Always keep going.
Yeah. Yeah.
Dr. Priya, at the end of all my shows, I like to ask my guests, what is one piece of advice that has really resonated with you over the years that you would like to gift the audience? Could be absolutely anything.
Ooh. Yeah, well, I would say don't lose hope. There are practitioners that care about you and that are compassionate and do listen. It's just finding them, which can be tricky, but don't lose hope. There's help out there. And I've just seen that body work and working with multiple practitioners and good communication, we can get people feeling better. So if you're feeling hopeless, don't lose hope. There is help out there.
Agreed. And Dr. Priya, where can people find you on social media?
Yes, so I'm on YouTube and TikTok and Instagram. Those are probably the main ones I do. I just joined Threads, I guess, too.
Yeah, me too. And I haven't posted anything yet. Yeah.
There's so many. So if you just type in the TMJ doc with like underscores between the words, you should be able to find me on all of those.
Awesome. Well, Doc, thank you so much for coming on. It was wonderful having you on. It was the first time somebody sat down and explained the TMJ disorders, and I think it cleared up a lot of things. And I would love to have you back on anytime.
Yeah, let me know when.
Enjoy your vacation to Hawaii.
Thank you so much. Thanks for having me.
Absolutely.
All right.
Okay.